एम्ब्रियो फ्रीजिंग क्या होता है, कैसे किया जाता है और किन पेशेंट्स में एम्ब्रियो फ्रीजिंग करवाना ऑब्लिगेटरी है और किन पेशेंट्स में इट इज एडवाइजेबल टू गो अहेड विद एम्ब्रियो फ्रीजिंग एंड सब्सिक्वेंट फ्रोजन एम्ब्रियो ट्रांसफर साइकिल्स। हेलो फ्रेंड्स, मैं डॉक्टर समिधा दलवी, आपकी फर्टिलिटी फ्रेंड, मेडिकल डायरेक्टर एंड चीफ IVF कंसल्टेंट एट पुणे IVF Fertility Center and Research Institute. So, embryo freezing is one of the important component of modern fertility treatments. Embryo freezing is a procedure in which the embryos, those are formed by eggs and sperms through IVF and ICSI in IVF laboratory, are frozen and stored for a later use in the subsequent cycles. So embryo freezing किन couples में करवाना mandatory होता है? Number 1, if you are a patient of PCOS. अब PCOS में क्या होता है, ढेर सारे eggs के होने की वजह से बहुत सारा हार्मोनल इम्बैलेंस सेट हो जाता है स्टिमुलेशन के दौरान। स्टिमुलेशन के बाद जब एग्स निकाले जाते हैं और उनके एम्ब्रियोज बनाए जाते हैं, अगर हम इस हार्मोनल इम्बैलेंस के एनवायरनमेंट में वो एम्ब्रियोज रिप्लेस करते हैं, मतलब अगर हम फ्रेश एम्ब्रियो ट्रांसफर करते हैं तो चांस ऑफ कंसेप्शन कम हो जाता है। इसके अलावा OHSS, that is ovarian hyperstimulation syndrome का रिस्क थोड़ा बढ़ जाता है। So PCOS patients में it is mandatory that we freeze your embryos and transfer them in subsequent cycle where the hormonal imbalance has been settled down. Number 2, in case your embryos are ready in the IVF lab but your endometrium is not optimum for the implantation to happen. So that is another condition wherein we freeze your embryos and transfer them in subsequent cycle wherein we prepare your endometrium thoroughly for a better implantation. Number 3, in case there is something called fluid in the endometrial cavity or polyp visible during the transfer phase, we do not transfer the embryos but we freeze them and transfer them after treating the conditions those are prevalent in the endometrium. Number 4, if there are any medical conditions prevailing, one should always try and treat those medical conditions and then transfer the embryos where the body is at a healthier stage. Number 5, where we have surplus embryos, like let's say if we have formed 5 to 6 embryos, we cannot transfer all the embryos in single go, right? So we transfer 1 or 2 embryos and the surplus embryos are always frozen for subsequent use for the same pregnancy or the next pregnancy. Last but not the least, we can also freeze the embryos wherein the patient has personal choice on delaying the embryo transfer and pregnancy. So how is the embryo freezing procedure done? For embryo freezing, obviously we have to stimulate the female's eggs with optimum dose of gonadotrophins, that is the hormonal injections. Once her eggs form adequately in size, we retrieve the eggs, fertilize it with the partner's sperms and form the embryos either on day 3 or day 5. Then these embryos are given a coating of media and they are frozen at minus 196 degrees Celsius and they are stored in the similar condition for n number of years. Once the couple is prepared for embryo transfer, these embryos are thawed, that is they are activated, and then the frozen embryo transfer is done. Hope this video was helpful to you. If you have any queries on the similar topic, please drop in them into the comment box below or connect with us directly on the numbers given. Thank you.